Hi, my name is Jonathan Garner, and I researched how climate change affects health. I looked at the lecture topics climate change and human health and the hidden costs of climate change on mental health. My motivation for pursuing this topic for this assignment is my interest in a career in medicine. I'm interested in how evolving climate issues and climate events are creating new issues that need to be accounted for in the healthcare industry. There's a close connection between physical, mental health, and the environment. So the environment can influence the physical health through heat-related illnesses, respiratory issues, and climate-related events can put strain on mental health with stress, anxiety, depression, and in the community, those can come together to create instability as there's strain between individuals. An important aspect of this issue is the healthcare cost of climate change. Financial capital is extremely important for paying for treatment and resources for these new issues. A study looked at the costs of climate events from 2002 to 2009. Heat waves accounted for $5.3 billion, and ozone and smog pollution accounted for $6.5 billion. In another study in 2012, they looked at all climate-related events and estimate nearly 920 deaths, 21,000 hospitalizations, 18,000 ER visits, and a cost of nearly $10 billion for the healthcare industry as a result from climate-related events. And another important resource is human capital, which comes in the form of physicians educating individuals in the communities and preparing for them to tackle these new issues themselves. So this education could come in the form of something like this, such as educating individuals about heat-related illnesses and explaining to them how increased heat and temperature can exacerbate cardiovascular, respiratory, and even renal disorders, as you put more strain on your heart and your lungs, and as you're dehydrated, it puts more strain on your kidneys and what they have to do. Diabetic patients also face increased sensitivity and increased complications in the face of heat. And then as a physician, it's important to explain strategies that community members can take, such as using government heat wave early warning systems, staying hydrated, and then advocating as a physician for policies to increase public access to drinking fountains and pools, policies that update building codes for increased energy efficiency and cooling, and also advocating for planting of trees in urban forests, which can actually work to reduce local air temperatures and alleviate some of these issues. Education could also include teaching people about pulmonary issues due to the high prevalence of conditions like asthma, as many young people face asthma, and that can be heightened by increases in pollen and heat and other strain on your respiratory system. Another important issue in the respiratory system is chronic obstructive pulmonary disease, or COPD. In 2012, it was estimated that nearly 6.3% of U.S. adults had COPD. You can see on the map that the blue areas, which include Maryland and Virginia, have a prevalence of 5.78% to nearly 7%. And so it's a serious issue that affects a large portion of the country, and it increases your sensitivity to air quality. Another important aspect of an individual's health is their mental health. It's important to spread strategies from a healthcare perspective in order to protect individuals facing climate-related events. So this can include preparing for emergencies, evacuating if possible ahead of a disaster, being able to check in on neighbors, and increasing the connectivity of a community and make people feel like they're being accounted for, and be able to monitor other people. Also be able to go out and seek treatment for your mental health if you find that that's something that needs to be done. And then also using healthy coping behaviors, being able to reach out to family, having a trusting support group around you of individuals that will be able to help you. Important adaptive strategies from the perspective of healthcare professionals includes being able to educate physicians and other professionals about providing new care for these climate-related illnesses that were not as prevalent as before. Also being able to spread knowledge, as I mentioned before, to build community resilience and community understanding so that patients can be aware of what's going on and be able to protect themselves. And also be able to focus resources, which includes financial capital, and be able to distribute resources to areas in need that are hit by climate events, and then also trying to increase the energy efficiency of hospitals and clinics and hoping to do their part in preventing climate change. This also includes performing relevant research as a physician for climate-related health issues, and then advocating for sustainable policies, as I mentioned before. To summarize the assets necessary to solve this issue, we need human capital to spread information from physician to patient, we need social capital to educate new healthcare workers to tackle these problems, and we need financial capital to fund treatments and resources. And together, these assets and adaptive strategies can come together to tackle this issue.